Hello and welcome to The Signal, Workplace NL's Health and Safety Podcast. Workplace NL is the Workers' Compensation Board in Newfoundland and Labrador, Canada. The focus is to promote safe and healthy workplaces, provide return-to-work programs, and offer compensation to injured workers and their dependents. This series of podcasts will provide you with the latest information on how workplaces can protect the health and safety of workers. Please enjoy the show.
An important part of occupational health and safety is how work and the work environment can affect workers' health. The Provincial Occupational Health and Safety Act requires health surveillance when workers are exposed to certain workplace health hazards such as noise, silica, asbestos, and lead. Health surveillance is a plan of repeated and ongoing health checks that can identify any health effects caused by work. Today we're joined by Jean Eustace, Certified Industrial Hygienist and Manager of Prevention Services, and Dr. Allison Fury, Senior Healthcare Officer of the Healthcare Services Department here at Workplace NL. They will be discussing health surveillance in the workplace in preventing occupational disease. Welcome, Jane, and welcome, Dr. Fury.
Hi, Deanne. Thank you. So I'm very happy to have Dr. Fury here today with us to talk a little bit more about health surveillance and why it is so important and kind of give that physician's perspective. Happy to be here. I guess just, again, to get this going, Allison, if you wouldn't mind kind of give me your perspective on why health surveillance is so important.
Well, thanks for asking that. I think it's important to identify why we even talk about health surveillance. And I think that, especially in Newfoundland and Labrador with the types of industries that we support, oil and gas and mining and, a lot of these industrial occupations, traditionally and years ago, there was very little focus placed on health surveillance or prevention of disease. And we review claims regularly where people had very significant exposures early in their careers and end up with very significant disease later in life, well after they've retired. And they may not know that or may not think that their exposures that they had at such a young age may have an effect on their current health status. So when we talk about health surveillance and the responsibility of employers and the responsibility of organizations like ours, the role that we play in making sure that work sites are safe and that people are being followed regularly and appropriately for the types of risks and hazards that they might be exposed to. The goal, I guess, is to reduce their disease or reduce the burden of disease as they age, because we know from all kinds of studies and statistics that your exposures when you're young affect your health when you're old. For instance, asbestos, you can have a significant exposure in your 20s, but we know that the typical latency for exposure and the onset of disease is upwards of 30 and 40 years. So 40 years after an exposure, somebody in their 70s might not say, oh, right, remember when I was working in XYZ, right, I had that exposure. Because at the time, they didn't know that asbestos was a risk, and they may not know that now. So we have, thankfully, as a medical community and as a Workplace NL and governments and employers and employees have made this more of a priority, and I think that the regular health exams and the importance of making sure that you advocate for yourself at the time of employment is hopefully making a difference.
Right. So what are some situations or industries where health surveillance might be required?
Certainly mining. It's loud, it's small, confined spaces, so you'd be at risk of hearing loss and hearing exposures if you don't have the right PPE. Other industries such as X-ray technicians or high radiation situations, even working in an operating room. field work where you're exposed to the sun. I mean, you don't
Right.
necessarily think that the sun is an occupational hazard, but for some people it is. So,
Right.
something as simple as sunblock is a part of
Absolutely.
PPE. So there's lots of industries or occupations that you don't even really think about.
I'm just
that
thinking,
might be-
I'm just thinking too, like, what about like music teachers and band teachers?
Absolutely, they're exposed
You
to
know,
all kinds of
like you
yeah.
wouldn't expect them to be in an industry or a job where they could be exposed to noise, but I would imagine that
Yep.
if you're a music teacher or a band teacher with all of those instruments playing, that could certainly put you at risk of a noise exposure.
Absolutely. I mean, there's lots of industries in Newfoundland and Labrador where you're exposed to, vibration, noise, silica, asbestos, even dust.
Yeah, and I think I would argue that there's health hazards in a lot of jobs. It's about knowing the risk and kind of evaluating that risk to determine if it's safe, at a safe level or at an unsafe level. So it's very important as part of hazard evaluation, recognition, evaluation, and control that we don't just look at the safety hazards, those things that maybe are a little bit more obvious, such as a floor that's irregular that could cause
Exactly.
someone to trip. A lot of times occupational health hazards are harder to identify. In some cases, they're actually invisible to human beings. Radiation is a great example. It's not something we can detect with human senses, with our eyes, with smell or taste or anything like that. And unfortunately, that means having a certain level of awareness and knowledge about the types of risks that might be present for a task or in a particular occupation or industry, and properly evaluating that to make sure that, again, it's within that safe range, so that your risk of developing some of these long latency illnesses is not increased. I do like Allison's point about health surveillance, being important to the individual, because really, I think for most of us workers, we're thinking about things like hearing tests and, again, certain types of screening measures as something that is directly helpful to them to identify early so that they can seek treatment for some of these conditions. And I do want to reiterate, there is also a benefit to the employer or the workplace to look at health surveillance as a whole, to determine, again, if the measures they're taking are sufficient enough to actually protect people. I often get asked specifically about noise because it's, again, a very common claim that we see. And if workers are wearing earplugs, which is a type of PPE, and we know from the hierarchy of controls that PPE should only be used as the last line of defense because it's not that effective. That's really why it's at the bottom.
It's very user dependent.
Exactly. So the importance of having people who wear earplugs having an annual hearing test is not just to ensure that their hearing is okay and they're fit for duty, but it's also to look at, again, the program that's in place to conserve people's hearing and making sure that it's effective and sufficient. So there's kind of two sides to health surveillance that both benefit workers in the province.
So, Dr. Fury, what role does a doctor play in supporting occupational health surveillance programs?
Well, the physician has a lot of different roles, and actually the type of physician that you're talking about is different. So you have your community physicians, your family doctors, and who these patients are going to present to eventually with their symptom. So for instance, your family doctor is your gatekeeper to every test, to every referral, and to helping to make the diagnosis. So as family doctors, we're kind of investigators. We make sure that we're asking the right questions, and we need to remember that occupational health history or occupational history is really important in determining why this person has a cough for 3 months. And I'm just using that as an obvious example. So if somebody comes in their late 50s and they've had a cough for 3 months and you really don't have a great answer, it should trigger in your mind, what does this person do for a living, or what did they do for a living, or where have they worked, and what kind of PPE did they use, and what types of exposures might they have had. And a lot of times a worker or a patient won't have considered that. And so sometimes triggering that in your patient is really important and can open up a huge possibility to help you figure out what's going on with this person.
And I imagine that's a bit more complicated in this day and age because people don't typically work one job.
Oh yeah, I mean,
life,
absolutely. I mean, and they work in different environments. They may have started out in the field, and then for the majority of their career were more in the office or something like that, just forgetting that they had been, working in a hazardous environment. Your community physician is really your gatekeeper and your investigator, and order the appropriate tests. The community physician is also integral in the surveillance part as well. Yeah. So when somebody comes in for their annual health exam or come in saying, hey, I'm a firefighter, maybe I should have a chest x-ray, even though they're not having symptoms, we have to judiciously decide whether or not this person's risks, how long have they been a firefighter, what types of exposures have they had, and really kind of help to determine when it is the right time to start doing that preventative surveillance. Similar for hearing tests. And these are resources that, we have to judiciously use, but also we need to be making it available to people who are at increased risk. So your community physician is very, very much a part of helping these patients and these workers make sure that they are being screened properly and also diagnosed properly. So that's your community physician. But then there's also the role of the occupational health physician who may work with employers or who may work here at Workplace NL, and just being a part of developing health surveillance programs and being involved in identifying hazards and making sure that the controls within workplaces are adequately and accurately identified. Right. And so there is definitely a consultation role that physicians play in the workplace. Not every employer has the benefit of having a physician to consult with, and but most of the big industry employers have an occupational health and safety arm with physicians and medical directors that help them with their surveillance policies.
So I'm an employer, and I am required to have a health surveillance program in the industry that I'm working in. For any employers that are out there and listening to this podcast, where do they start putting this program together?
Well, it's very important that they have a solid risk assessment. Right. And I know that we do talk a lot about risk assessments from the perspective of health and safety, but it's very important to know what the potential hazards are before you begin trying to develop a health surveillance program, and to know not just whether they're present, but also at what level of risk. So usually with health hazards, that involves some type of measurement, going out and actually assessing a worker's exposure to, say, a dust or a certain type of fume or gas that's in the air. From the perspective of noise, it would be going out and actually checking the noise levels, in, say, a shop, or when people are using a certain tool, to make sure that it falls within reasonable limits. Just to make a point on that, most of the health hazards that we have identified kind of as a whole do have limits, and making sure you're below the limit, if at all possible, and kind of using the concept of ALERA, as low as reasonably achievable, is a very good place to start from, to be proactive in reducing people's exposure. Really only once you've determined that level of risk and you've kind of made the call that your controls are not sufficient to protect, would you actually go about doing things like introducing PPE and introducing things like health surveillance programs. You're basically saying we know there is a risk, and that we cannot effectively control it to a point where where this is not needed.
It's important, I think, too, to identify that there are so many jobs out there that we have risks that you can't mitigate. Like, there are, if you're going into a burning building to save somebody, you have to go in the burning building to save somebody. But there's all kinds of risks that go along with that, and exposures that you don't have control over. So yes, identifying the risks is there, but sometimes you can't achieve a reduction in that risk. And you still need to have somebody do that job.
Yeah.
So then that's where the surveillance programs come in, but it's also where the active preventative measures come in as well, from an employer and an employee point.
Right. As we learn more, then we change the way that we do things. The science comes together, as the research comes together, as occupational health and safety evolve, then we realize that in order to improve, I guess, the services that we provide to workplaces in the province, that we need to give them as much support as what we can. Ultimately, we're all here to prevent workplace incidents and occupational disease. So
and make sure that if they do have an injury or if they do develop an illness outside of their control, that we're there to support them and that we have the services that they need and that we're able to ultimately, support them in the way that they need to be supported for their recovery.
And I do see that as a two-pronged approach, and I really do want to reiterate what Dr. Fury is saying there. We need to be able to provide people compensation, fair compensation for risks that they took years ago when we didn't know better. Or perhaps if they had an employer that simply didn't take proper controls. But again, from the side of prevention, we also want to ensure that future generations of workers in the province are protected, so that we don't see the same sort of injury trends that we tend to see with things like asbestos. Asbestos is kind of an interesting one here in the province because we did have a mine here. We have quite a few claims that have come out of that mine and from other industries as well, not just in mining. But we're tracking and trending now, and we're seeing really a peak of claims for asbestos-related exposures today. And again, our mine has been closed for decades.
But that coincides with the latency, timing with asbestos, and so we hope. I think what Jane's getting at
is that
we're coming at the peak, but then if the exposure has reduced over so many years, that we will reach a point in our claims that we have less.
Now, my only concern with asbestos is that we know that it's in a lot of infrastructure here in the province, because again, it was a very common material that was used. So there is a potential for a new curve to come about from those industries where people might be exposed to building materials, whether it's through renovations or demolition. And of course, it's important to note that asbestos wasn't truly banned in Canada until 2018.
That's right.
So there are a couple of industries, in particular the automotive industry, that continued to use asbestos right up until that date when it was banned. So we could see another curve that is unrelated to mining that again could involve one of those two industries. And
but hopefully with some of our knowledge that we have gained since the 1960s, that perhaps some of if we are protecting ourselves from those exposures, that I'm not sure that we will eliminate the risk altogether, but perhaps reduce it significantly so that the number of our claims are less. I would expect that would be the trend, but I guess we'll see.
So what types of testing is involved with health surveillance? I know it depends on the hazard and whatever, but what kind of test would you use?
Typically for dust hazards, you are looking at things like pulmonary function testing and chest x-rays, because typically with dusts, the issue is that they deposit in the lung where they can cause damage over time, over long periods of time. For example, if I was exposed to silica, say yesterday, I wouldn't necessarily see any symptoms at all for years. Mm-hmm. So it might take a lot of time before I even present symptoms. It also may not be clear cut in the early diagnosis of my illness what specifically I've acquired, whether it might be, say, silicosis, lung cancer, or some sort of COPD type condition. Again, sometimes it takes a while for the symptoms to continue to decline. But I do think it's important to note that a lot of our respiratory conditions that we do see at Workplace NL are degenerative illnesses that are unlikely to ever be cured.
They're usually very progressive.
Yes.
And like something like idiopathic pulmonary fibrosis, where you have a constant exposure to these dusts and these types of hazards. And you're right, it takes a long time for symptoms to manifest themselves. However, early in a career, a chest X-ray, just as a baseline, is oftentimes very helpful to have on file. It doesn't necessarily mean that you have a chest X-ray every year, because that's radiation exposure. So, you have to make sure that your surveillance programs are not potentially causing harm, or over utilizing our resources, but that they're used effectively and timely for our patients. So like, for instance, you're asking about, what we would do, pulmonary function tests and chest X-rays, like Jane said, in the event that you're getting a respiratory exposure, might start occurring in your 50s, or after your exposure would have been in your 20s. So there aren't any specific guidelines for each type of exposure.
Yeah, and as you're talking, I'm thinking, like, is this something that you do on an annual basis? But I guess it depends on what they're working with.
Yeah, and I think the only one I can think of that's maybe a bit more prescriptive is silica. So here in the province, because of our high quantity of silica in our mines, and again in the ground here, we have what's called a silica code of practice. So it's kind of referred to in our regulations, but it sits as a separate document.
And we've talked a lot about, what tests we do for the hazards that we know about. The other part of health surveillance is identifying trends within workplaces. And, when we see high incidence of a certain illness or a certain injury or a certain diagnosis, that might trigger somebody in occupational health and safety to say, okay, well, maybe we need to be looking closer at what our hazards are. And so that's also another arm of health surveillance, is identifying trends. I mean, we didn't touch on that a whole lot during this discussion, but that is another part of it that is important to identify, I think.
Absolutely. Yeah. Unfortunately, sometimes it takes quite a lot of people becoming ill to determine if something is truly dangerous.
And you can see sometimes the difference, and this is an interesting correlation, I think, is that it takes 100 years for asbestos to be banned, and it took 3 months for us to implement masks with COVID. We acted very quickly on that, and and identified the risk and identified how we could stop the spread, and implementing the parameters around an illness that was certainly considered at times an occupational hazard to healthcare workers and frontline responders. That happened very quickly in comparison to something like asbestos.
Absolutely.
This has been a very interesting conversation that we've had here today. I'd like to thank Jean for joining me, and Dr. Fury for joining me as well in this very important conversation about occupational health and health surveillance programs.
Thank you for joining us today. Transcripts are available to use in your workplace to increase workers' knowledge in various occupational health and safety topics. Visit workplacenl.ca for more information on the services we provide to workplaces. Feel free to share the signal on social media to improve workplace health and safety everywhere. Thank you, and have a safe and healthy day.